And we are live. Hello, everyone. This is Dr. Jennifer Joe with my co-host, Dr. Ami Bhatt, with MedTech Insights. MedTech Insights is a weekly interactive talk show led by me and Ami, where we interview two guest leaders in digital health every Tuesday at 12 noon Eastern Standard Time. We are a lean production with just me and Ami, and our desire is to connect and learn from you and from other great innovators. Healthcare is fast changing. We love hearing from those directly on the ground, creating change, learn from clinicians practicing on the front lines, and from VCs and investors about what they think are disruptors in healthcare. Please join our mailing list and look for us on LinkedIn, Facebook, Twitter, and YouTube.
Good morning. Afternoon. Good afternoon, everyone. Good morning to the West Coast, and almost close to good night to those of you joining us from abroad. I saw we have some people from India with us. It's really great to be here. So we've had some great weeks. We're especially excited about today. Our guests today have done some fascinating work, both on the app level and in terms of doing some larger scale studies, really looking at activating patients, patient empowerment, and we'll have some great discussions about digital health equity and really empowering those patients who perhaps were left behind in the past. So I think it's going to be a really good discussion. As a small caveat, everything that Dr. Joe and I talk about here are our own opinions and do not represent any of the institutions or organizations with whom we work or collaborate. But hopefully we'll have a robust discussion today. Feel free to type in your comments on whichever platform you're watching. I do have my cell phone too, so for those of you guys who have that directly, feel free to send it on there and I'll take a peek. And maybe we'll get started because we have, oh look, Germany has arrived, because we have so much to talk about. So first, we're going to introduce our youngest entrepreneur ever on the show, which is incredibly exciting. His name is Kunal Gandhi, and he is the CEO and founder of a new app called Simple. So why don't we bring him on and we'll have him tell us a little bit more about it.
Looking forward to meeting Kunal.
Hi, everyone. Thanks.
Hey.
Thanks, Jen and Ami, for having me.
Great to have you with us, Kunal. So we are incredibly excited to hear about Simple. We know that we have some videos that we can show as well, but I was thinking maybe will you start by just telling us a little bit about what to expect, how at this young age you got interested and then managed to really build such an impressive app and reach so many people.
Yeah, absolutely. So Simple is an AI-enabled rehabilitation software, specifically trying to help people with back pain. And the journey kind of started with watching people in my household in wheelchairs. My grandfather and my mom on different sides of the family tree had some physical issues and strokes. So I started to get into exercise and fitness to try to prevent injury or illnesses from happening to me, and became a certified trainer, but still managed to injure my back. So it kind of made me realize that no matter how much information was out there, we're still at risk and we need an extra set of hands or an extra set of eyes watching us. But physical therapy and personal training can be really expensive. Not everyone can always afford, the hundreds of dollars an hour that they put into treatment. So, we're trying to democratize health, personal training, and physical therapy, similar to a lot of other companies in the digital health space.
That's fantastic. I was just reading some stats about back pain, and actually here in Massachusetts, we've had such a focus on the opioid crisis as we do throughout the country. And back pain was one of the leading needs for the use of narcotics, simply because people didn't really know how to take advantage of physical therapy. And you make a great point. It's not accessible to everyone. It's not cost efficient, and it's not time efficient. To go and find time out of your day to regularly do this with somebody who can watch you is hard. So to be able to bring that into the home is incredible. I know that we have a video of actually how the exercises work. And so maybe, Jen, if we can show that video, Kunal, you can tell us a little bit about, how you guys built this. And I know a lot of people throughout the country, a lot of students actually went into helping kind of build and grow this with you. So maybe, Jen, if we can show the video, that'd be great.
Try not to squat too low on the way down. Don't bend over too much. Great form. Move your left wrist until it's directly above your elbow. Good work. Keep it up. Bring your hips lower so that your back is straight. Great form.
Fantastic. So she doesn't sound like she gets more mad at you each time you do something wrong. So that's a huge plus for this app, because I'm sure I would need constant correction. How did you guys build this, put this together? How'd you build your team? You know, you're so young in a way. How did you find the right people to do this?
Yeah, the way we were able to build this was, I guess, only because of the team. The team is super, super strong. We brought together 20 over 20 students across 15 universities across the country. When their internships were canceled, students were looking for opportunities to get their hands on a computer science or computer vision based project. So there's a lot of excitement about the project. One person in particular, my co-founder, Jay Chawla, he's been an incredible leader, an incredible inspiration to the team. So definitely want to thank him because without guys like him and Nick Gandhi, the app isn't possible. So, just huge shout out to them.
So speaking of shout outs, you got a huge shout out, I believe, recently, perhaps from a couple of famous people in the NFL. Jen, do we have that little intro of who these people were?
Thanks, Justin. I'm always on the lookout for the next generation of business leaders and believe it's so important to recognize up and coming talent. We work with Cowboys linebacker Jalen Smith and his incredible organization, the Minority Entrepreneurship Institute, to identify a young, talented business person for this year's Young Entrepreneur Award. With more, here's Cowboys linebacker Jalen Smith to share our winner.
Thanks, Magic. I'm here with Young Entrepreneur Award winner, Simple. I'm here with Kunal, and please, thanks for being on, and let us know a little bit about your company.
So this is incredibly exciting. I feel like, I'm sure you felt this way too, right? During COVID, this all had to be digitally separate. Otherwise, you would have been in the room with them. We're going to claim that we were in the room with them today. I feel like we should just be able to do that. But this is exciting. So the Minority Entrepreneurship Institute, incredible organization. And one of the key focuses in general is really thinking about how to help athletes take charge of their own health, right? And beyond that, how to help all of us who kind of wish we were athletes or want to be physically active to really feel more empowered about kind of engaging in these kind of activities. And oftentimes, if I go to a gym and I pick something up and I'm going to lift it, I don't know what I'm doing. I may be a little bit embarrassed about what I'm doing, and I definitely don't know how to do it right. Kunal, can you tell us a little bit about what is the likelihood of people actually injuring themselves when they do exercise? Does this happen often? Is this what keeps physical therapists kind of in business?
Yeah. So, I mean, basically what we're finding is 3 in 4 people aren't actually adhering or doing the exercises basically correctly. And what we're trying to do is, get people to do the corrective exercises for starters. So a big problem in physical therapy is, you go in Monday, Wednesday, and Friday, but then Tuesday, Thursday, Saturday, and Sunday, a lot of people tend to drop the ball. So we're trying to boost adherence. And when looking at, research from the World Health Organization and, speaking to the customers directly, they mentioned that the lack of real-time feedback and the lack of that human connection on the days that they're at home is what's really preventing them from doing these exercises, or what makes them feel less motivated to do these exercises. So, we want to provide the resources and the tools so that, no matter someone's socioeconomic status, no matter someone's race, gender, whatever the case is, they have access to this app and they can reduce their pain levels by even if it's just a small amount, they can reduce their chronic pain levels. As someone who's had chronic back pain for a number of years through a weightlifting injury myself, like I feel like if only like this tool had existed for me, like maybe I wouldn't have gotten injured in the first place, or I would have known to do the extra 30 minutes of stretching after workout, or foam roll, a lot of things that we take for granted now, or the research is pointing us towards now. I think that push towards prevention should be the focus of our dialogue, and I think it will be the focus of our dialogue as our generation continues to push innovation forward. So
yeah, that's one of these areas that we talk about a lot, right? Is prevention has not generally been a concept, especially in cardiology, but I think in general in medicine, prevention has not been a concept that we have taken to low SES or specific races and ethnicities in this country who are underserved, right? Prevention has been a higher SES kind of specific race concept for us, which is people who are generally healthy or the worried well, taking advantage of it. And there are such opportunities for us to really say prevention is for everybody. And so I think your app really does that. This might be a good time for us to bring on Jorge Rodriguez to join the conversation. He is our second guest. So Dr. Rodriguez is a hospitalist, and he is the technology equity researcher at the Brigham and Women's Hospital in Boston. He's also an instructor at Harvard Medical School. And he too has a great interest in really thinking about what does equity look like, and especially over this past year as technology has become so essential, as you said, Kunal, for people to be able to connect on those days where they're just by themselves at home. How do we do so, and how do we do so in an equitable way? So let's bring on Dr. Rodriguez as well.
Hey, Jen, thanks for having me on.
Absolutely. Great to have you with us. So Jorge, this is incredibly exciting to have you and Kunal both here together, because you attack the idea of kind of digital and health equity and technology from different areas. But as we discussed in our kind of pre-conversation on Sunday, both of you come from a very similar place of, in a way, living in the experience of what was missing and then trying to fill that gap. So will you just start by telling our audience a little bit how you ended up becoming the technology equity researcher at Brigham?
Yeah, of course. Yeah, I mean, a lot of sort of my passion really lies in kind of the intersection of social justice, medicine, and technology, and a lot of that is really personal. Having been an immigrant to the U.S. and having experienced a lot of the disparities that we sort of often hear talked about in the healthcare system, and you guys have already mentioned when talking to Kunal, this really became quite a personal experience for me, and through my time and my training, I realized that technology could really be a powerful tool for equity, and so that I've really tried to push the envelope and make sure that as we're striving for health equity using technology, we don't end up developing technology inequities or digital health inequities. And so that's been a lot of the focus on my work, especially with patient-facing applications like patient portals, like mobile apps, and more increasingly like telemedicine or telehealth.
That's great. And I think, if I'm correct, over this past year, you had several publications that kind of came out rapid fire. I think the uptake of technology was so abrupt, as we've discussed in the show before, beginning in the spring, especially in the United States, that we just had so much more volume to study. And you were really at the forefront of leading that. Will you tell us a little bit about kind of those studies and what you did? And I think you may even have some slides if you want to kind of share with our audience to kind of walk us through that.
Sure. Yeah. Let me share my slides here. So I think as you mentioned, a lot of over the past year, we really had a few different papers that came out. For example, we had one paper that came out showing that certain populations, racial ethnic minorities, those with limited English proficiency, older patients, and those living in low broadband access areas had lower access to video visits, for example, as compared to telephone visits. And that was kind of quite striking in terms of a lot of comparing kind of that component to who we know had sort of worse outcomes during the COVID-19 pandemic. So sort of striking how digital health equity was sort of aligning with kind of health inequities in general. And so it really kind of came to front that we really have to try to focus on digital health equity. And so it seems like a kind of very nebulous term. One way we've tried to sort of define that is really saying that everyone should have a fair and just opportunity to engage with digital health tools, like for example Kunal's app, which is great. And in order to do that, you really have to start off from the perspective that technology access and literacy are really social determinants of health. And by that, I mean, in order to use any app or any sort of technology tool, you have to assume that the patient, one, has a device, two, has internet access, and 3 has the ability or the literacy to like meaningfully engage with this tool. And so really focusing on this as a social determinant of health, I think is essential. And in order to achieve digital health equity, I'll sort of highlight kind of five key things here, which I think are key. One, I've mentioned already: technology access and literacy. I think the other piece of this is implementation. So as we're implementing these tools, for example, as telehealth is being implemented or an app is being integrated into a healthcare system, asking questions like, is the app available in different languages? Has this been tested with folks of different literacy levels? What are we going to do for someone who doesn't have a device or doesn't have internet access? And making sure that as we're applying these digital health tools, we're not sort of leaving part of the population behind. And then with regards to payment, so much of the reason that telehealth took off was because there was payment parity across different telehealth modalities. And so in this case, you really have to align your payment with what you're doing. And so, for example, some of the recent changes where phone visits may not be reimbursed as well as video or in-person visits really puts a little bit of a challenge and just creates a natural place where inequities can occur. So I think aligning the payment, I think, is key. And then the last part of this is really viewing this, we sort of mentioned earlier, like the worried well, really viewing digital health as a standard part of care and not sort of a nice add-on. And part of that, I think, is sort of all the things I've mentioned. And I think the other part of that is really, realizing the fact that, checking our own biases at the door and realizing that we can't tell a patient's likelihood of using digital health just by looking at them, and really having a conversation with patients to say, here's a tool, is this something that's of interest to you? And that's sort of the way a few highlights the way we've kind of approached things that I'd like to share with you today.
That last sentence is so key, right? You can't tell a patient's likelihood of using digital health by looking at them. And I have to tell you, many of us fell into this implicit bias issue as spring and summer came with COVID, in that we carried some assumptions. And I'll say one of my assumptions was a little bit of ageism, right? Which was probably the older patients wouldn't be able to connect. And I'll tell you, not only were they able to connect, but they were so incredibly robust at times on their ability to engage with us, use televisits, use digital health. And I think two things happened. One is they also, a lot of grandparents kind of lost contact with their grandkids this past year. That was a big issue. And two things happened. One is they learned to connect with their grandkids and therefore connected with their health, or vice versa. We walked them through and navigated the process with them, and all of a sudden their world opened up. And so we most certainly saw that you can't really make those assumptions. So there's a question that I just got put into my feed, which is actually for both of you, which is, as we think about what you were just saying, Jorge, that the state lines starting to become an issue as a lot of this payment parity cross state line, virtual health becomes more challenging. People have to now get licensed to be able to provide care across state lines. Do both of you, and maybe Jorge, you can answer first, and then Kunal, see a role for more things like apps and text-based messaging and other companies that aren't built directly out of a physician's practice playing a role in how you do preventative health or digital health or help people?
Yeah, I mean, I think for sort of, it seems like for independent apps that may not be directly integrated to, I think there's a big opportunity there. I think the key really is about, really focusing on the patients that need the most help. I think if you look at other studies in other areas, for example, there's a study that came out of UCSF by Dr. Bates and Dr. Sarkar and Dr. Bates over at the Brigham, which looked at a series of chronic disease apps, for example. And what they basically did was they took a series of apps, they gave them to patients from low SES, and asked them to do data retrieval and data entry tasks, and said, how much of this can you do? And they found that they were only able to do about 50% of them. And so if you can imagine, if you can only do 50% of any app, it's not going to be particularly useful. You want to take full advantage of it. So I think there's an opportunity there, but I think you have to really kind of go into it with the idea that I'm building this for who's really, suffering from chronic diseases, who really has the worst outcomes, and then you can really sort of make an impact.
That's great. And Kunal, I'll ask you to answer. I'm going to add one thing because somebody else just wrote into, they're also curious about whether you're thinking of having your app be in different languages in the future.
Yeah, so I think Jorge answered the first question on the money. So with the second one, with having different languages in the near future. So currently our app's being used in 17 countries, and that was one of the main highlights that we realized, in that a lot of people's first language isn't English, and when working so when there's an international problem like back pain or musculoskeletal disorders, we have to take that into account. And our goal is to basically have the voice that's in your headphones or the written text that's on the screen be selected by the user in their native language. I actually have a question for Jorge. What sorts of onboarding questions have you seen work really well in telehealth products?
What do you mean onboarding in terms of like, what do you mean by onboarding?
So like when a patient's signing up, what kinds of questions can you ask someone to test their literacy in using, digital health products?
Yeah, it's a great question. I think there's a few different things. There's some more validated things. There's like something called eHeals, which does more like validated digital health literacy. But when you really kind of simplify it down, some of it has just been like, do you have a device that you use on a daily basis, and which one is it? And then how often are you using the internet? And do you have someone who helps you with the internet? And I feel like so far in some of the work that we're doing, those kind of questions have really simplified it down. Because the other thing you have to think about is like in the workflow of bringing someone on, either at registration or otherwise, you can't get too crazy with your questions because time is of the essence. And so just like simple things like that would really kind of gets you a good part of the way and gives you a sense, how much support is this person going to need.
And Jorge, in terms of your knowledge and exploration, when we think of apps, I think we think of a phone, but it doesn't necessarily have to be on a phone. And Kunal, I don't even know if yours is always on a phone, but maybe it's an iPad or other modalities. Maybe Jorge, you could talk about what modalities you've seen either evolve or are right for certain groups, and then Kunal, you could talk about your experience.
Yeah, I mean, I think one of the classic, probably undervalued kind of modalities is text messaging is sort of a classic one, right? Fairly low tech, but we can really have an impact and probably has better penetration than sort of like a mobile app. I think is one. I think kind of like web apps rather than sort of like native Android or iOS apps, I think are the other component. That way you don't need to like download something. You can just go to a website and then you're sort of like engaging. I think one area where I often think about, but have not seen in terms of sort of like underserved populations, have not seen developed as well, is sort of like the voice-based world. I think in terms of overcoming challenges of literacy, there's a lot of opportunity there. Obviously that requires having a fancy device.
Sorry, what is a voice-based world?
Oh, sorry.
No, I just
no, that's I'm in my own head. I know things like Alexa, Google Home.
This is voice-based. Okay.
Yeah. So that overcomes a lot of the kind of like written literacy challenges and allows you to kind of interact, similar to where Kunal's app was kind of prompting you with voice, kind of giving you voice response rather than having you read something. I think there's a big opportunity there.
And so, Kunal, I'd love to know, when you designed your app, who you designed it for initially, and then what was your learning along the way and how people interact with it?
Yeah, originally we designed it in sort of a fitness focus. So helping people learn how to work out for the first time, or for athletes that wanted to take their game to the next level.
For you, no, for me, for both of us.
Yeah.
Did you really have to call out the first time athlete thing? I could have used it during my golf swing yesterday.
You can
bad happened on this side of my body. Sorry, Kunal, keep going.
Elbow pain now. Go ahead, Kunal. Sorry.
I completely forgot. I think, yeah. So it was for beginners and for athletes who wanted to take their game to the next level, but couldn't necessarily afford, the highest quality of training. And that kind of goes back to, athletes in low SES that have really, raw talent, but can't afford the coaching and the resources. We see like that nature nurture argument happen all the time. And I think this is one of those situations where we can give, all people the tools that they need. So that was the original sort of plan with it. And then we, had pivoted a couple of times to, social media fitness sort of platform, and then over to the rehab space. And then when we went into the rehab space, we realized that was just such a wide net. And back pain was a very specific problem where we felt like we could start really, narrowed and focused, but then also reach over half the population, because they say that 1 in 2 people suffer from back pain in their lifetime. 1 in 10 people are suffering from back pain right now on this call. It seems like there's one here, and are there multiple?
It's intermittent.
So 3 and 4 people on this call have back pain. And I think when we look at the pandemic, like with COVID, more people are sitting at their desks for longer periods of time. And I think we're going to see these numbers kind of skyrocket, unfortunately. And with simple and with, active sorts of lifestyles, I think we can try to slow that rate down as much as possible.
That's fantastic. So I'm just, I'm looking at there was a Boston Globe article that was published, and they were looking at the NCAA's Division I schools. And they said African-American men at college or university are 13 times more likely to be there on a football or basketball scholarship. So just thinking of the sheer number of kids who are out there who are getting to college based on their athletics, and yet, as you said, don't have necessarily the health guidance to get there, right? So I think it's both patient empowerment, but it's also patient safety. It's an issue of kind of keeping our athletes safe as they're pushing this hard to be able to get the opportunities that other people have as well.
Okay, so Ami doesn't work in the ER, the urgent care. You're a cardiologist, so you don't. Back pain is probably like 20 to 50% of what I see just on a regular day. And then there's knee pain, shoulder pain, ankle pain. But back pain is huge. As Americans, we're not great at preventing it. We're not good at explaining the standardized treatment options. So Kunal, I think that's huge. But I also am fascinated with the concept that could we enable more lower SES socioeconomic status groups to move through more safely through an educational system or whatever it is with these apps or more accessible educational wellness platforms. Just something that I have, like you've introduced into my head. And so Kunal, you started with, it sounds like your own experience with back pain, and how has COVID changed what you've done or the uptake and usage of the app?
So we launched in the middle of the pandemic.
Oh, really? So you're brand new?
Yes. Yeah.
You're brand new?
Yeah.
They moved
you
that
won
fast.
NFL award? Was it an NFL National Football League?
Yeah, we're still fairly young. I think we'll be hitting our 1-year anniversary in July on our launch. So yeah, that's been super exciting. And with COVID, we've been able to reach, people, and we've gotten some mentors that I don't think we would have been able to meet in real life, just given their geographic locations. So that's been a huge blessing. But at the same time, like our focus is just, really just helping people with their physical ailments and pains. Like at the end of the day, like the pandemic has been super, super tragic for a lot of people. And for us, we just want to make sure that we can provide the best possible care that we can. So.
Oh, that's great. So one question looking forward for both of you. We're really trying to think about empowering patient groups. We're trying to think about preventative health. We're trying to think about increasing the quality of care that people are getting, basically by putting more availability of these kind of apps or devices in people's own hands. What do you think is the biggest obstacle to us really getting uptake of this in the general public for each of you? And maybe Kunal, if you want to go first, and then Jorge will give you last word.
So I think the biggest challenge is that at least we've seen is people have to want to do it from the patient side. Like I feel like with our software, it's usually the people who have been injured before that really see a lot of value in it. And I guess if someone's never really had a physical ailment, it's tough for them to appreciate the prehab exercises and the rehab exercises. And even someone who is injured, it's still really difficult. So I think having the narrative around prehab and rehab into the educational system, just like Jen mentioned, like I think that would be a huge driving force for the next generation to kind of treat MSK and back pain and such as a serious sort of ailment, because I think that it's one of those sorts of ailments that people, or it's one of those sorts of disabilities that some people look at as, you know, a small sort of issue. Back pain is just back pain. I don't need to go get help for it. I don't need to do anything about it. It'll go away if I sleep on it tomorrow. So I think changing the narrative is probably, to me, would be like the most important thing that our generation can do to try to, you know, push that forward one step at a time. And even all generations, I think we all need to be talking about, MSK disorders and back pain. So.
Fantastic. Yeah. I think that's a great point, right? That awareness, that health literacy, it's true for so many different disciplines. We see it in cardiology as well. Just, how to be heart healthy, but the same thing, how to be healthy with your body, how to kind of focus on that, musculoskeletal arena and be safe. Jorge, thoughts from you about major kind of obstacles in the future to uptake?
Yeah, I mean, I think I've sort of mentioned a couple earlier in the slides, but I think the big thing I always think about is sort of kind of meeting patients where they are. I often remember we did a kind of small qualitative study, and we basically did some focus groups where we talked with a few patients. In this case, they were Spanish-speaking patients, and we were talking to them about like the patient portal that the hospital was offering. So the hospital had just gone through this like very big marketing campaign to get word out about the patient portal. And it was very interesting to talk with them. And the patients were basically like, yeah, it's cool. I can see my medications or make my appointment, or that sounds cool and all, but like, how does that really help me with like my food insecurity or my housing insecurity? Like, and so there was this sort of this disconnect between like what we had built the tool to do versus like where patients were. And I think similar to what Kunal saying, is like really listening to patients and creating that sense of like, here's where we're going to engage. Here's how we're going to solve your pain point. And I think I think telehealth is a good example where like there was a clear pain point there. Like people wanted to stay away from the healthcare system. And so that sort of naturally came to be. And I think for other areas of kind of digital health, we haven't quite met that. We sort of thought about what we think would be a good solution to a problem, but sometimes it wasn't a problem for the patient at all that we were trying to solve. So I think really focusing on where patients are and what their pain points are, I think can really kind of boost uptake in the long term.
That's exactly right. It's funny in our household. So for those of you who know my husband, Professor Neil Minyar, he's professor of public health. And so to us, it's always been funny that people consider medical care and public health as two separate entities, when in fact they are so intertwined, as both of you have discovered, and therefore are kind of achieving really a lot by recognizing that. So I think that's wonderful. So Chris Barkey's asking for Dr. Rodriguez, what are the most important steps for technology developers to make sure they're creating technologies for all groups? And I think you touched upon this a little bit, but if you want to just review that for him.
Yeah, so I mean, I think the first key thing is sort of like, looking at whatever your solution is, and if you're really trying to address the issue, looking at the kind of demographics of who's really being impacted by whatever you're trying to build, and really kind of engaging those users in sort of a user-centered design as part of your process. I think it's sort of very high-level way to think about it. I think in terms of making it more accessible to everyone, I think there's components around having available multiple languages, even if it's just one or two up front. And then two, making sure that it's written at the appropriate literacy level. We had looked at diabetes apps a few years back and found that a lot of, even just the description of the diabetes apps was written in a very kind of like high level reading level. And so I think kind of going through that process is key. And then when you're doing testing, really making sure that you're testing it with users of all a diverse set of users, I think is the other big piece of it. There's you can reach out to me. There's more kind of granular stuff that we've thought about before, but those are sort of some high level points.
That's great. I strongly recommend that people reach out to Dr. Rodriguez. So you're on Twitter, quite prolific on Twitter. Is that @TranslatedMed? Did I do that right?
That's right. Yeah, @TranslatedMed. You got it.
Yeah. So I think that's also been a great place for a lot of us to learn from you, and to be able to kind of ask more questions and think about how to do this right. Okay. Janice asked, where did this idea come from? how did you do this at so young an age? So you talked a little bit about family experience, Kunal. Sorry, Jorge, I'm not going to make the assumption that you're not the young one here, but I'm going to make that assumption. Sorry for my implicit ageist bias. But Kunal, you talked a little bit about the family experience with being able to do exercises and not hurt yourself. How did you do this at so young an age? I don't know what the answer to that is, Kunal. What's the answer to that?
It's a tricky question. I honestly, I never really think about my age when I'm working on this project. The only thing that I have in mind is just trying to solve the problem. It's something that has interested me for the last few years, and maybe I just got a head start. But I think just waking up every day knowing why you're doing what you're doing doesn't make it feel like work. And I deal with the problem, I guess, the back pain problem myself. So it's kind of a reminder every single day that kind of make it go away for other people. I always joke with our team and with my family that, you know, if I could be the one person or the last person that suffers from back pain, I'd be happy to take that sacrifice and so that no one else would have to go through back pain, because it sucks. I mean, I remember sitting in classes not being able to sit up straight. I'd have to like slouch, and the piriformis syndrome, and so yeah. I mean, it's just when I felt the passion, I felt that relentlessness, and I just read a lot of books, and it was the team. I mean, it wasn't even just me. It wasn't me at all. Honestly, I kind of just stand here and smile and talk about what we did, but it's really the team, and yeah.
You know, it's fantastic. We had some VCs on with us. Actually, the last show, Payal Divakaran was with us, and she said so much about the companies that they're interested in investing in VC is about the leadership and is about the reason why, right? The why that wakes you up every morning, that keeps you doing this work and interested in making changes and making it better. That's what those, venture capital, private equity people are looking for, because they really want to make a difference, but they know that just their money doesn't make the difference. It's really the team and the leadership that you've built. So congrats to you. Jen, any final thoughts for these two? I know we tend to go over a little, but there's so much to talk about.
No, I really appreciate everyone for tuning in. Really excited to have Kunal. Congratulations to the NFL award that you won. And Jorge, your research is just simply amazing. I'm so glad that you are able to join us. Should we let our guests have some last words, Ami?
Yeah, absolutely. Kunal, you want to go first and then Jorge?
Sure. Yeah. Thank you for the time today. Thanks to everyone who came out and listened, and feel free to reach out to me on any social media platform. I'm on LinkedIn, Twitter, Instagram. So feel free to reach out and follow our journey with Simple. And again, thanks for popping in.
Eagerly, thank you so much for letting me come on. I think one final thing that I'll say around sort of digital health equity is, remembering that at least my ultimate goal is really health equity. And so I really feel like digital health equity is only sort of a tool and a pathway to get to health equity. So really making sure that we're kind of building these tools with the ultimate goal. But otherwise, thank you so much for having me on. I'm also on all sorts of social media platforms at Translated Med. That's where I mostly hang out, on Twitter. So feel free to reach out.
Such beautiful words to end with. I mean,
we can't do any better than that. We had a great time with you today. We look forward to watching both of you as you both move forward and continue to have successes that really make a difference in our patients. And we will see you, the audience. Thank you for joining us again next week at 12 noon Eastern time. And we're going to have actually Rose Higgins and Beth Freitz join us next week. And so really a female entrepreneurship day, which I think is going to be incredibly exciting, talking about how some people have broken through glass ceilings. So have a wonderful day. Have a wonderful week. And again, Kunal and Jorge, thank you so much for joining us.
Thanks, everyone.